Hi, everybody. Welcome to Experts Dig In with Doggies for Dementia. I am Carmen DeValis, founder of Doggies for Dementia Foundation. And I have today Mackenzie Kelly, who is going to give us some great information on family home care. And we'll talk about the differences in there. And she is Director of Client Services for Senior Helpers. Welcome.
Hi, thanks for having me on today, Carmen.
Oh, yeah. You've been a great resource for me and for everyone I help for a while. And so you're my trusted resource for this.
Thank you so much.
Yeah, you're welcome. And so when we're talking about home care, let's talk about then what is that, the home care? What do you mean by that?
That's a really good question because a lot of times I found that clients or family members, even caregivers, sometimes don't know the difference between home care and home health care, for example. So home health care is more on the skilled side of things, whereas home care is non-skilled in most cases.
Define skilled. Define skilled.
Yeah, definitely. Home health care, typically there's a nurse involved, like an LVN or a RN who will come out once a week maybe to do health checks on the client because they were just discharged from a hospital or a rehab community facility. And so they need that extra medical attention. Home care, on the other hand, is typically paid for by the client personally or their family. Home health care is covered by insurance, whereas home care, like what we do here, is covered by long-term care insurance, workers' comp, and then private pay from the client. The other difference there is on the non-skilled side, and I say non-skilled because it takes a really good caregiver to be able to know how to do the things that a client needs and to pick up on what they need. They can do things around the house just to help the client remain in their home longer or to bounce back after a surgery or being in rehab maybe to get more independent. So they can help with laundry, light housekeeping. They can drive a client to errands or doctor's appointments. They can pick up prescriptions. They can do the dishes. They can do that laundry. In some cases, they do things that are more skilled, but still not necessarily considered medical, like emptying a catheter bag, changing a brief, helping a client get dressed in the morning, giving them a bath or a shower, and making sure overall that they're just taken care of and they're living their best life. It's really all about quality of life, and having a caregiver in the home allows the client to maintain that quality of life.
Well, that's really great because, and thank you for that clarification, because I think it is confusing. Home health care is so similar to home care. It's just the health that's in there. And the difference is the licensed help coming in to do specific tasks that only, say, nurses can do, the licensed staff can do. And then so the direct more personal care and help with some of the tasks and chores and stuff. And that's where y'all come in. And so I imagine then a lot of time, if there isn't that long-term care, the insurance, and then people are paying out of pocket.
Right. Yes. And I know you mentioned the different licensures. We do have a lot of caregivers who have their certified nurses aid license, which just allows them to do more and get that training. It means they went through a program and they really stuck with it and learned how to care for an individual. I got my CNA certification in 2004 when I was a junior in high school, and I still have it today. And I found that it's helpful, but a lot of times we'll also have caregivers who've been practicing and working with clients for several years, and they're just as good as the CNA.
Okay. And so as a family member, you probably don't, I was a nurse's aide too, from when I was 15.
Yeah.
A really long time ago. And so, I know all the training and the experience and things. And so that's a part of then what you explain to the families, what they can do and what makes each one special. Do families get to choose most of the time then? Do they interview? Is there an interview process?
So that's the great part about working with the agency. typically what happens in the workflow is a client or their family or even a healthcare provider will recognize that they have a need for assistance at home and make a recommendation that they look for a home care company. So the first step is calling, and then once we get that call, client care specialist will go and speak to the client over the phone and then meet in their house if they're comfortable with it right now. I know because of COVID, things are a little bit different. Sometimes we'll do a Zoom meeting, but during that time, it doesn't cost anything to go out and do the assessment. And we explain to the client what to expect as well as discover what the needs are of the client. Mm-hmm. And when that happens, we kind of talk to them about what type of caregiver they want. And over here, we do something really interesting. We ask them if they want an eagle personality, a peacock personality, or an owl personality in the home. And it really gives us an idea of, do they want somebody talkative? Do they want somebody loud and vibrant? Or do they want somebody who just gets things done? Mm-hmm. And when our HR department is able to hire on our caregivers, they're able to get that face-to-face contact with them, find out what their skills are and what they're able to do, how much experience they have, and their personality. And then we, as an agency, mesh the two together.
I think that's wonderful. Personality is so important. It's not a right or wrong. We just have different personality types, and we do better with some than others. And sometimes people need more peacocks that are more energetic to get you going, right? And
yeah, definitely. Especially if there's a client in the home I found who, just got discharged from a rehab facility, and they have PT and OT coming out maybe once or twice a week, but they need that special encouragement to continue to do PT and OT. They need that caregiver who's going to be in there every day to motivate them to get up off the chair and walk to the mailbox, even if it's just to check the mail. Those steps are really important in continuing to allow that client to get stronger.
Yeah, I get that. And I imagine many of us get that even more after being on quarantined ourselves recently, or this year. So 2020 for this year, those who are watching later, and what does it take to get us off the couch? And where we would have thought it would be easy if it means your health, of course you're going to do your exercises, but the tendency is like, oh my gosh, I'm overwhelmed as it is, and I just want to sit here. And
and even me, as a healthy younger woman, I was laid off on March 22nd from my previous job, and I was sleeping in until 10 or 11 o'clock, and I was staying up past midnight. Just having somebody in the home to help get that motivation going and having a reason to do things is super helpful.
Yeah, I think more and more people are going to understand that, where maybe they didn't before, they will now, because they've been there, right? I think that is, if there's any blessings, and so that might be one. There's that understanding of what it's like then to be home and to feel kind of helpless, and I don't know, there's some personality types that just say, hey, I just want to let me just sit with this for a while, and there's others that are more active, and you can tell the difference because I watch them walk by from my couch.
Definitely.
Yeah, there are days I just, so that's really important. And, it's what we're really talking about is assessment also, right? So there's the personality types, and then there's got to be more too that y'all assess for.
Definitely. It's so hard sometimes because during the assessment, we usually allot for 1 to 2 hours. And if there's multiple family members, sometimes it takes even longer. And that's okay, because we want to get a clear picture so that when we get a caregiver on the schedule, we're able, as client care specialists or directors of client care, we're able to explain in detail to the caregiver what to expect. And one of the things that I really like about where I work now is a differentiator called a life profile. And a life profile, they've had 18 years of research over 22 states, and there were over 200 participating organizations and agencies. And they've really drilled down 5 key areas for a patient or client to successfully stay in place. And so we review those areas, and this is in addition to activities of daily living and instrumental activities of daily living. It's medical condition management, safety, autonomy and independence, burden of care, and quality of life. So we really get down into the minutia to find out what it is that the client needs in order to be able to be successful in their home. And then even down to a specific percentage rate, once we score everything up and calculate it, we're able to see if there will be any chance of failure. We'll see areas of opportunity in the home. For example, if a client who has fall risk has like area rugs, obviously that's not good. So we can step in and say, I noticed you have area rugs. Were you under the knowledge of knowing that? That's a really weird way to say it, but did you know that
you could fall?
you could trip over those? Those are fall hazards.
Yeah.
You don't have any grab bars in your bathtub or your shower. Just simple changes can really help make a difference. We had a client who their bed was the right height, but they had satin sheets. And so it created like a slippery kind of environment. And so a lot of times you went, and you said it earlier, you said education. A lot of this is educational. And we really have a chance to make a difference in people's lives. And that's what I like about this position and this role and even this industry. Everything's different every day, and we have the opportunity to make a difference, which I really enjoy.
That's wonderful. And we learn more all the time, right? And I think sometimes to go back on, sometimes it's the simpler things that we're just used to seeing in a home, in our home, that we don't think about could be hazards. And,
right.
You know, it's almost like when you bring home, when you have a toddler come visit, you just don't think about the things.
Right.
And I'm saying that because I have that situation, like, oh, I forgot those books were at that level, because I'm used to seeing it that way. I'm just used to seeing the rugs and various things and things that could fall easily if someone were to, you know, grab onto the wall. That's another hazard, right? And you just don't think about it. So you mentioned several things, and there was one, the burden of care. What does that mean?
So the example for that I like to provide is actually from my own experience. My grandfather in 2016, he was diagnosed with small cell lung cancer, and it fell on our shoulders. We quickly realized as a family that hospice could only provide so much care, and his wishes were to pass it home. And as his condition kind of grew and escalated and the cancer spread, the nurse would come more frequently, but she couldn't stay to change his briefs or make sure he was fed when he wasn't able to feed himself. And she didn't give him a bed bath, although eventually we did get some assistance with that from hospice. My grandfather's cancer spread to his brain, and he would get confused, oftentimes try and struggle to get out of his bed. And then he was a little bit heavier. And so it was really hard for us to get him back into the bed. So eventually the hospice nurse said, well, Mackenzie, you're over here taking care of him. Listen, your mom's not helping. She's working. Your grandmother's too old to work, and there's no other grandchildren nearby. Why don't you think about calling a home care agency? And I was like, what? And she talked me through it, which was great. This was with Hospice Austin. And she explained that we could hire somebody to come in for as little or as many hours a day to help take some of that burden of care off of me. And so really and I'll tell you what, as soon as we got a home care agency out there, it was like this backpack that was invisible on my back filled with rocks slowly started to empty, and the weight was off my shoulders. And my grandmother and I were able to get back to whatever normal looked like. And so we went to dinner together. The first night he had care for 3 hours. We went to the grocery store. It was just nice to give peace of mind for family to know that he was taken care of, even for a short amount of time. Getting that break as a family caregiver, if you're not healthy yourself and you're not good for yourself, you can't be good for the person you're taking care of. And so I was forever thankful that we got home care in for him.
Well, yeah, what a blessing, because and I think that what you use for the vision there, carrying a backpack of rocks, but you don't realize it. And then there's the worry that goes with it also. Am I doing it right? And I don't, maybe a lot of people have never needed to be a caregiver before, and they don't know. And they don't know. And the big worry is, am I going to do more harm than good? And, and all of that. And I remember one family in particular, the wife said, I have a choice. I can be his wife, I can love him, or I can be his caregiver. But I have a hard time doing both because the
Right,
caregiving is a full-time role. It doesn't allow me just to sit and be with him and love him. And I
right,
thought that is perfect way of describing it because what we are experts at are loving our loved ones, but that doesn't mean we have to be doing the all the hands-on care also.
right.
Yeah.
Well, and
So,
those breaks are so important too. I mean, just for my own sanity, for my grandmother's sanity,
oh,
um, it was it was amazing. She still thinks of the caregivers at that time as part of her family.
yeah. Oh, yeah. Oh, that's wonderful. So, this is Doggies for Dementia. So, for families who have a loved one with dementia, is this something they can consider too?
Oh, definitely. I know with dementia, a lot of times there's a lot of redirection. There's a lot of confusion. We've taken care of clients in the past who they hallucinate and they see visions and then they wander off after the visions. A caregiver is really good at redirecting. A lot of our caregivers have been through TPA SNO's GEMS training, which helps determine the different levels and educate the different levels of Alzheimer's or dementia, and in ways to work with clients in better ways than if you didn't have the training. So redirection, giving activities to do, reassurance, patience, those are all really good things for caregivers to have in their toolbox to help clients with dementia. And
Yeah.
I know also my great grandmother, she had dementia, and I just needed a break, but I also needed to know that she was okay. So having a caregiver
Mhm.
allowed me to not listen to the same story 10 or 15 times in one day and get away from her calling me my mom's name, um, and being mad at me for something my mom did. Those are all things that happen for people who have dementia and Alzheimer's, and that break is really important so that your well-being is good enough so you can be with the loved
Yeah.
one.
Yeah. Again, so you can still love them as a family member and just be
Yeah,
that person who loves them,
right.
that granddaughter and things. Yeah. So I imagine and you can tell me if I'm right or wrong, but for families with people with dementia, this might help them to care for their loved one at home longer, especially if they're thinking they would really love to avoid a placement in a memory care or assisted living. And
Yeah,
a lot of times, I promised I would take care of them at home. And how do I do that?
yeah.
The home
That's
care can help a
definitely
lot,
something
right?
we're able to do. One of the main goals of home care is to keep clients at home as long as possible and to keep them there safely. And one thing I hear a lot from caregivers, family caregivers, is they feel like they're giving up on their loved one when they have somebody come in to help. And that's absolutely not the case. I try
Hmm.
to be as encouraging as possible when I go to meet a family and let them know you've done the right thing. I can see a little bit of fear in your face. You're worried. It's going to be okay. Even if the first caregiver we pick is not the perfect fit, we will find it. And
Hmm.
we'll make sure that your loved one is taken care of just like you'd want to take care of them.
Yeah, and actually, in saying I will care for you at home and not seek placement doesn't mean you will do it alone. And seeking
Right,
help is a way of helping to run that marathon versus a sprint for a short time, and
right.
which is still difficult. So, what about time? The hours in a day? Could it be very short sometimes, or what if they
Yeah,
need
it sure
longer?
can. It all starts with picking up the phone to give us a call. Once we find out after the assessment and the initial phone call what the needs of the client will be and their family, then we're able to really help craft a schedule. And our caregivers can work, we do 12-hour shifts, 24-hour shifts or live-ins. And our caregivers typically, somebody wouldn't work all 24 hours, but we can provide a caregiver up to 24 hours a day for clients. I had a
Hmm.
client just a couple weeks ago. He had been admitted into hospice care, being discharged from the hospital. And the last week of his life, he was on 24-hour care at home. And
Hmm.
I thought that was the best gift the family could give him to help them be with him in his final days.
Right. Yeah, I love that. It was a gift. Yeah, it was a gift. Yeah. Well, so much information, and the home care piece, and I think for dementia is really, really important. It's important for everyone, but when it comes to Alzheimer's or dementia, the care is 24/7 for most, if not it's close, and it's a
Yeah,
lot. It's a lot, and there's also the times where it's just not comfortable being the one doing the personal care. If it's,
right.
I mean, the family members, maybe it's, a son and a mother, and it's just not like, he's just like, yeah,
Yeah.
that's just
Well,
not,
mom
that
is
doesn't
modest,
fit with,
right?
yeah. And the son
And
is
that's
like,
okay.
okay, yeah. And then like, well, yeah, you don't have to, and it doesn't mean you love them any less. In
Right.
fact, you're finding another way to help take care of them and still be present. It's just kind of a change in mindset there, to
Yeah.
get that help. And
And
I
that's
got,
okay.
yeah, and I think too that the time of when you really, really need it is a crisis time. And so for families out there, and you probably have this too, they start shopping earlier than they think they really need help.
Right. Well, and we see that a lot, I think, with hospice admissions. You're probably familiar. Clients and families often wait until the last minute before they need the care because they think they can do it, and then they can't. They hit a wall.
Yeah.
We see that a lot too. And so educating yourselves on options is always a good idea, even if you're not ready just right now. Just getting that initial call in and searching out answers to your questions is helpful. I try to be a resource in the community for anybody who might have questions related to home care or even home health care. I have a lot of people that I know and I rely on and trust just like you. And even if people don't choose our company, I'm still willing to have a conversation with them because I can empathize and I can
Mhm.
understand where they're coming from because I've been there myself.
Yeah. So good to know. Okay, well, I think we've answered a lot of great questions, and I'm gonna suggest to those who are viewing, put your questions in the comment section, and we will get back to you on those. And if I know that there will be some really good ones, so we might even repeat this and answer those questions, because
Yeah.
this is really, really key, I think, to successful caring for someone. And I don't, I know when I worked with families, they were under the impression that they should know all of this. And I thought,
So,
where would you have learned this? And
yeah.
nobody was just one day you wake up and you're a caregiver and like, I got it. There's a lot of stuff to know, and there's a lot of great
Right.
resources too. So that's the thing.
Yeah. Well,
Yeah.
thank you so much for having me on,
Yeah.
Carmen. I look
Thank
forward to
you.
talking with some of your viewers and answering their questions at a later time, or even I might just type in the YouTube channel down below.
That would be awesome. So we'll answer your questions in the comments. And thank you so much. Tough topic, but so important. Yeah, so important.
Yeah.
All right. Thank you,
Thank you.
everybody. Yeah, thanks for watching Experts Dig In for Doggies for Dementia. We'll catch you next week. Bye-bye.